And a pleasant good evening to everyone. In St. Kitts and Nevis, to date, we have reported 19 confirmed cases of COVID-19 so far, and all 19 have recovered. The Centers for Disease Control, or the CDC, designated St. Kitts and Nevis as a destination with a very low risk of COVID-19 transmission. The COVID-19 situation in the Federation is stable, and we need to remain ahead of this virus. Despite this, last week saw the highest number of COVID-19 cases reported globally so far. Over 43 million persons have been diagnosed with this disease, and over 1.15 million have died. In the Caribbean, over 266,000 cases have been reported, with over 158,000 recoveries and over 4,000 deaths. The mental and psychological impact of the COVID-19 pandemic is significant. Many are still working from home. Some children are still attending virtual classes. Some are not able to share milestones with loved ones, and some family members are not able to mourn the loss of loved ones as they should. As for the healthcare workers, we are still on the front line, and our lives have not been normal for some 9 months now. However, we must continue to do our part in preventing and containing the spread of this highly contagious virus. Tourism is the main economic driver for the Federation. Our borders were closed to international travel in March of this year, and our borders will reopen this coming Saturday, as Valencia just highlighted. Our borders will be reopened to international travelers and tourists. Our aim is to reopen safely with minimum risk of reintroduction of the virus to the Federation. Please note that the COVID-19 outbreak is worsening in our source markets, with over 8 million confirmed cases in the United States, over 875,000 cases in the UK, and over 220,000 cases in Canada. Based on this fact, we have confirmed a robust set of protocols to ensure safety of the frontline workers in the hotel and tourism sector and the safety of our people on a whole. We must all do our part for this to be successful. So my task tonight is to provide you an overview of the health and travel protocols and to provide you an update as to our level of preparedness for the weekend. By way of background, 3 weeks ago, we would have shared our intent to participate in the Caribbean bubble, which includes 8 Caribbean member states: Anguilla, Antigua and Barbuda, Barbados, Dominica, Grenada, Montserrat, St. Lucia, and St. Vincent and the Grenadines. Over the past 14 days, that is between October the 12th and present, St. Lucia reported 25 confirmed cases with a total of 54. Barbados reported 25 confirmed cases, bringing its total to 233. Antigua and Barbuda reported 13 cases, bringing its total to 124. The Ministry of Health and the HEOC, the Health Emergency Operating Center Committee, is continuously monitoring the situation in these territories and looking out for evidence of community transmission of COVID-19. We are in the process of evaluating the risk of participating in the Caribbean bubble. So now let's look at the health and travel protocols that comes into effect on October the 31st. Well, all inbound travelers to the Federation will fall into one of two categories. One, you're either coming from the Caribbean bubble or you're coming from a territory outside of the Caribbean bubble. So let's look at what pertains to those coming in to the Federation from one of the Caribbean bubble territories. So if you have been residing in one of the Caribbean bubble territories for at least 21 days, and once you would have taken a PCR test within 72 hours of boarding the plane to St. Kitts, and once that test is negative, and you would have landed at our airport, you will be subjected to screening at the airport. And so there are focused history, medical history will be taken, your temperature will be taken, and if asymptomatic, you will be allowed to integrate into the Federation without a period of confinement or quarantine. If you are coming from a Caribbean bubble territory, you are free to stay at a private residence with a friend or a relative, or you can stay at one of the COVID-19 certified non-branded hotels like Sugar Bay, Timothy Beach, Golden Rock Inn, Mount Pelier, Nisbet Plantation, Hermitage, Mount Nevis, the Hamilton, and the Penny's Beach Hotel. If you are returning national, let's say you are returning national coming in from the United Kingdom or New York or Miami, you are required to submit a negative PCR test, which should have been done or taken within 3 days of travel to the Federation. And we recommend that you take this test at an accredited laboratory. Nationals returning from within the Caribbean bubble, and if you intend to stay in St. Kitts, you can stay at a private residence or at one of the non-branded hotels. If you are a national returning from outside the Caribbean bubble, New York, Miami, United Kingdom, you are free to stay at the following locations. You can stay at Oali Beach Resort in Nevis, Potworks in Nevis. You can also stay at the Paradise Beach in Nevis. You can stay at the Ocean Terrace Inn or the Royal St. Kitts Hotel in St. Kitts, or either of the 4 franchise hotels, namely Four Seasons Resort, St. Kitts Marriott, St. Kitts Vacation Beach Club, Park Hyatt, and the Koi Resort. Returning nationals and residents may also opt for pre-approved quarantine, and you will be asked to pay for the security facility and the attendant security fees. Interested returning nationals or residents may access the pre-approved option by visiting the website www.covid19.gov.kn www.covid19.gov.kn. What are the entry requirements for tourists or international travelers? If you are a tourist, you'll be required to complete the entry form and submit a negative PCR test taken at an accredited lab within 3 days of travel. The inbound international tourist or traveler must submit confirmation of hotel reservation at either of the following hotels: the Park Hyatt, the Four Seasons, St. Kitts Marriott, Marriott St. Kitts Vacation Beach Club, Royal St. Kitts Hotel, Koi Resort, or the Paradise Beach, Nevis. The traveler will be required to undergo health screening at our airports and will be asked to download and install the St. Kitts Nevis COVID-19 mobile app. If the tourist is without symptoms, he or she will be allowed entry into the Federation. The inbound traveler or tourist will be vacationing in place at their hotel with access to an approved package of services for the first 14 days or for the duration of stay if shorter. The international tourist will be required to do serial testing. He or she will be tested on day 7 and on day 14. When tested on day 7, if the traveler receives a negative PCR test, he or she can be allowed through the hotel's concierge or tour desk to access COVID-19 approved tourist attraction sites on the island in a secure bubble. All international travelers and tourists would be tested on day 14 if their stay or vacation allows for that. And once the result is negative, the traveler or tourist will be allowed to integrate into our society. So that provides you an overview of the entry requirements for persons coming into the Federation from territories within the Caribbean bubble, for our returning nationals, and for tourists. So now I just want to provide you an update regarding the status of plans for the reopening of our borders. The Ministry of Tourism, St. Kitts Tourism Authority, and the Nevis Tourism Authority, and the members of the National COVID-19 Task Force would have conducted a series of stakeholder meetings with the management of the hotels. We would have conducted a series of site visits to all of the above-mentioned hotels to evaluate and assess the protocols and the package of services that will be offered to the high-risk tourists. The goal is to offer these services with minimum risk of transmission of the virus within these hotel properties. In essence, these hotels are ready for our reopening. I want to inform you that the St. Kitts and Nevis Health mobile application is also ready, and our airport, the RLB International Airport, will be ready by October 31st. Ladies and gentlemen, we are doing our part to reopen our borders safely. However, please note that we all have a role to play in the safe reopening of our borders. As individuals, we have a responsibility to prevent the spread of the virus by adhering to the measures we have now gotten used to. And these include the wearing of the face mask, hand hygiene, sanitation, making sure those high-touch areas are clean, physical distancing, ensuring that we maintain a physical distance of at least 3.3 feet from others when in public spaces, and social distancing, avoiding mass gatherings. Let us continue to follow the science and work together to prevent a second lockdown. Let us continue to work together to fight the COVID-19 virus and rebuild our economy. #TogetherWeCan. I thank you.
Thank you very